Welcome, I'm Martin Sheen. The quest to combat disease and improve the quality of human life has led to great advances in healthcare. And we are a privileged generation because many of the most significant strides have been made in our own time.
Hospitals are commonly known as places to get better, a refuge for those who are on the road to recovery. But in many hospitals across the country, people are being discharged in worse shape than when they were admitted. In some cases, they're dying. In fact, the Centers for Disease Control report that an estimated 99,000 people die every year in our hospitals from something unrelated to what they went in for. The cause? Hospital-acquired infections that are, in some cases, being unknowingly passed along by the people who are in charge of taking care of our patients.
When patients come to the hospital, unfortunately, they can get an infection. Medical studies have shown that fabrics, such as doctors' and nurses' lab coats and scrubs, can carry bacteria from one patient to the next. Even though doctors and nurses are very careful about washing their hands, we obviously cannot change our garments between every patient contact. This is particularly unfortunate when a patient comes in for elective surgery and they're otherwise not ill.
Research has found that you can find bacteria everywhere in the hospital environment, particularly superbugs like MRSA are a concern. And you can find them on computers, TV remotes, trays, bedside stands. And when a physician or a nurse goes from one patient to another, they can pick up these superbugs on their clothing and move them from one patient to another.
The American Medical Association gives further merit to these findings in their 2010 Board of Trustees report calling for more research in textile transmission of infections. While hand washing is still considered paramount in preventing bacterial transmission, certain hospitals are taking the initiative one step further by encouraging all members of the healthcare team to wear antibacterial lab coats and scrubs. Here at McNeil Hospital in Berwyn, Illinois, doctors and nurses are wearing lab coats made out of a material that can actually prevent bacteria from sticking.
Antibacterial lab coats and scrubs are coated with Triactive, which is a hydrophobic dendrimer impregnated with silver. Any bacteria that stick to the coat are killed by the silver. This coating has been shown to be effective against all the worst bugs, including MRSA, C. diff, VRE, and E. coli.
Developments like this are good news for hospital administrators who don't want to see their patients getting sick as a result of a stay at their hospital. What's more, each hospital-acquired infection costs big bucks to treat.
$30,000. It costs about $30,000 to treat each one of these infections. These infections will lengthen the patient's stay in the hospital. The organisms are oftentimes more resistant to antibiotics and require more complicated treatment. So preventing these infections is very important. Not only does it improve that individual patient's outcome and improve their health, but it also saves the hospital money, allowing us to take care of more patients, allowing us to purchase more of these coats so that we can save more patients' lives.
A do-no-harm approach to medicine can mean many things to many people. For some healthcare professionals, it comes down to a simple change of clothes, becoming part of the fabric of patient care.
Modern medicine continues to improve. As it does, those improvements will be highlighted here. See you next time. I'm Martin Sheen, and thank you.